Hi, I am Dr. Kyra Christine A. Rios from the Department of Family and Community Medicine, representing the Occupational Safety and Health Committee. Workplace safety in our hospital. Today, I want to emphasize the critical importance of workplace safety in our hospital. While we often focus on patient care and advanced medicine, we must also recognize the unique challenges and risks present in a hospital setting. By staying aware, proactive, and collaborating as a team, we can significantly reduce these hazards. Lecture outline. Discuss why workplace safety is essential. Occupational Health and Safety Committee. Highlight common risks we encounter. Share practical steps each of us can take to foster a safer environment for everyone. Why does workplace safety matter? Workplace safety is all about your well being. No one should go to work and expect to get hurt. A safe workplace means you can do your job effectively without fear of injury or illness. Our patients' well being. A safe environment for staff directly translates to better, safer care for our patients. If we're not safe, we can't provide the best possible care. Team morale and productivity. When people feel safe and valued, morale improves and productivity increases. It's a win win. The hospital's reputation. A hospital with a strong safety culture is a hospital that's trusted by its community and respected in the healthcare industry. Medical committee dealing with the prevention and treatment of diseases and injuries occurring at work or in specific hospital occupations. OSHC recognizes that the environment, the nature of work, and the inherent qualities of the worker interact in a complex manner to determine the health status and vulnerability to work related risks. Accident prevention is likely to assume a more pronounced role in this committee. OSHC may have overlapping roles with other committees, but collaboration is welcome. Main responsibilities of Occupational Health and Safety Committee. Knowledge of the work environment of each sections. Pre-placement, periodic, special examinations for employees, for doctors. Administrative responsibility. Treatment, rehabilitation for those in need for doctors. Health education and advice. Efficient record keeping for accidents. Surveillance of high-risk groups. Liaise within the hospital committees and outside organizations. OSHC is a cross disciplinary area concerned with protecting the safety, health, and welfare of people engaged in work or employment. The importance of OSHC. Occupational safety and health is a basic human right for safety at workplace. The goals of occupational safety and health programs include to foster a safe and healthy work environment. Understanding OSH may also protect coworkers, family members, employers, customers, and many others who might be affected by the workplace environment. OSH management is responsible to ensure the safety and health of the persons at work and other people who might be affected by activities or people at work. The approved safety and health program shall be communicated and be made readily available to all persons in the workplace. Common hazards in a hospital setting. Common hazards in a hospital setting. Biological. Sharp injuries, needles, scalpels, broken glass. These can transmit serious infections like hepatitis B, hepatitis C, and HIV. Even a tiny prick can have a devastating consequence. Chemical. Chemical exposure. Disinfectants, medications, laboratory reagents. Many of these can be harmful if not handled properly. Physical. Radiation exposure. For those working in imaging departments, proper precautions are essential. Fire and electrical hazards. Hospitals have a lot of electrical equipment and sometimes flammable materials. Safety. Slips, trips, and falls. Wet floors, cluttered hallways, loose cords. These are incredibly common and can lead to fractures, sprain, and head injuries. Ergonomic. Back and musculoskeletal injuries. Lifting patients, pushing heavy equipment, repetitive tasks, these can take a serious toll on our bodies over time. Psychosocial, workplace violence. Unfortunately, healthcare workers can sometimes face verbal or physical aggression from patients, visitors, or even colleagues. Burnout and stress. While not a physical injury, chronic stress and burnout can significantly impact our health, judgment, and overall safety. Your role in making our hospital safer. Workplace safety isn't just the responsibility of management or a safety committee. It is truly everyone's responsibility. Here's how each of us can be a safety champion. Being a safety champion, be aware and vigilant. See something, say something. If you see a spill, a cluttered hallway, or a piece of faulty equipment, don't just walk past it. Report it immediately or address it if you can safely. Always be mindful of your surroundings. Are there signs for wet floors? Are pathways clear? Follow protocols and procedures. Hand hygiene. This is our first line of defense against infections. Wash your hands thoroughly and frequently. Proper sharps disposal. Always dispose of needles and other sharps in designated puncture proof containers. Never recap needles. Safe patient handling. Use lifting aids, get help, and use proper body mechanics when moving patients. Protect your back. Chemical safety. Read labels, follow mixing instructions, and use proper ventilation. Know where the safety data sheets or the SDS are for chemicals you use. Personal protective equipment, PPE. Wear gloves, masks, gowns, and eye protection whenever required. It's there to protect you. Report incidents and near misses. Even if no one was hurt, a near miss or an incident that could have caused harm is a valuable learning opportunity. Report it so we can identify and fix potential hazards before someone gets hurt. Report all injuries, no matter how minor. This ensures you get the care you need and helps us track trends and improve safety. Insist on reporting of all injuries. Adopt a well designed accident report form. Train all levels of management. Participate actively in accident investigations. Speak up and ask questions. If you're unsure how to safely perform a task, ask. It's always better to ask than to guess and risk an injury. If you see an unsafe practice, politely and constructively address it. We're all in this together. Participate in training. Our hospital provides regular safety training for a reason. Pay attention, ask questions, and apply what you learn. Take care of yourself. Manage your stress, get enough rest, and take breaks. A well rested and less stressed individual is less prone to errors and accidents. Creating a culture of safety. Safety is a shared value. It is not just a department, it's how we operate. Open communication. Everyone feels comfortable raising safety concerns without fear of reprisal. Continuous improvement. We learn from our mistakes and are always looking for ways to make things safer. In conclusion, working in a hospital is challenging yet fulfilling, emphasizing the importance of workplace safety. Each staff member has a vital role in ensuring the safety of themselves, their colleagues, and patients. By pledging to be safety advocates daily, we can transform the hospital into a model of a secure environment, enhancing the healing experience for everyone involved. Thank you for listening. I am Dr. Kyra Christine A. Rios from the Department of Family and Community Medicine, again representing the Occupational Health and Safety Committee, and welcome to JRRMMC. Always make sure to be safe.